My name is Dr. Kunal Jain and I am a medical oncologist. So today we will be talking about cancer in general and what are the various facts associated with cancer and its treatment. So the first question that comes to mind is what is cancer? Cancer basically is uncontrolled growth of cells in the body. Normally there is division of cells, they keep on multiplying, dividing, and at certain point of time body will tell them to stop that process. So there will be a stop signal built in the body. But cancer basically does not have that stop signal, and there is an abnormal proliferation or growth of the cells, and they keep on multiplying and form a tumor mass, which can spread from the site of its origin and can go to different parts of the body. So that is basically what is cancer. And if we talk about a prototype cancer that we will discuss today, I am going to take example of breast cancer, because it is one of the most common diagnosed cancer in women in across the world and also in India. So moving on to further about causes of cancer, there are various causes, or as we say, risk factors which cause cancer. Some of them are modifiable, whereas others are non-modifiable risk factors of cancer. Some of the factors which we can modify in our day-to-day life is lifestyle related factors like our diet, exercise, smoking, tobacco, alcohol. So these all are the risk factors which we can modify by some way or the other, and we can decrease the risk of cancer significantly. For example, if we talk about tobacco or smoking, it in itself is related to almost 30% of cancers. So if we promote healthy lifestyle without smoking, we are already getting rid of 30% of the cancers. On the other side, there are some factors which we cannot modify. For example, age. As we keep on growing older, the chance of developing breast cancer keeps on increasing. Again, going back to the example of breast cancer, the incidence is increasing year by year. And if we talk about Western statistics, for example, in United States, 1 in 8 women will develop breast cancer during their lifetime. And the similar statistic applying to Indian women, about 1 in 25 women in India will develop breast cancer during their lifetime. So that is the magnitude of this problem, and it is becoming common and common mainly because of the unhealthy lifestyle that we are following. There are other risk factors also related to specific types of cancer, but we are not going into the detail about those causes. Coming to the diagnosis of cancer, it can be diagnosed by various modalities depending on what type of cancer we are dealing with. Starting from as simple as blood tests, which can diagnose some of the types of blood cancer. Other tests like scans, X-ray, ultrasound scan, CT scan, MRI or PET scan will be needed as per the need or as per the diagnosis of the patient. But the gold standard test, the main test which is vital or most important in diagnosing any type of cancer, is a needle test, or what we call as a FNAC or a biopsy test. So without that test, cancer cannot be diagnosed, and that is one of the myths that is prevalent in the community, that we are not going to get any needle test done because it might lead to spread of cancer. That is totally false. So we need to do a needle test so that we can diagnose the cancer correctly. Cancer can be detected early. That is called a screening strategy, when there is no symptom in the patient and still we can detect cancer, so that early treatment can be initiated and outcome will be much better. So screening is available for various cancers, and the prime examples of those are breast cancer and cervical cancer in women, and colon cancer in both males and females, and prostate cancer in men. Recently, there is some evidence to suggest high-risk screening for patients who are smokers for more than 30 pack years for detecting lung cancer. But I think we should definitely focus on breast cancer and cervical cancer as screening strategies, because these are the two most common cancers diagnosed in Indian women. Stage of cancer varies from stage 1 to 4. As we keep on increasing the number of the stage, going from 1 to 3 to 4, it means that cancer is more widespread in the body. Stage 4 being that it is spread to other organs in the body also, and most of the cases of stage 4 cancer will be incurable. So it is very important that we diagnose cancer in earlier stages so that the outcome is better. The treatment options of cancer include various modalities like chemotherapy, which is basically treatment with medicines, radiotherapy, which is also called treatment with radiation or rays, surgery, which is very important, especially for solid tumors. For curing the cancers like breast cancer, surgery has a vital role, and various other modalities of treatment like specific targeted therapy, which includes hormonal therapy or other monoclonal antibodies, which may be expensive. There is a common thinking among people that chemotherapy is very painful, but I just want to emphasize that that is not true at all. Chemotherapy as a process is not painful at all. Most of the chemotherapy drugs are given by intravenous route, where cannula is inserted in the vein and chemotherapy is administered by infusion, which I mean IV set and glucose or drip that we commonly use. Some of the chemotherapy drugs are also available in oral form like tablets, but majority of them are still in intravenous form. And it can be given in different schedules. Different chemotherapy for different types of cancer in different stages have different schedule. For example, some of the drugs can be given on a weekly manner, some can be given on a fortnightly manner, but most common regimes of cancer chemotherapy involve 21-day cycle, that is 3 weekly cycle, when it is repeated again and again. So the chemotherapy has certain side effects. It has benefit because it is circulated all throughout the body and kills cancer cells wherever they are present. But it also comes at a price of some side effects, which vary from some minor side effects to sometimes life-threatening side effects. It can cause alopecia, which is hair loss, which is common with most chemotherapy drugs, but it is not universal. Not all chemotherapy drugs cause hair loss. Patients can develop mouth ulcers. They can have nausea or vomiting. Some patients can develop diarrhea, especially with some types of drugs. Patients generally feel fatigued for a few days after chemotherapy. They can have body aches. They can have infection. So that is one of the most dreaded complication of chemotherapy, because it causes decrease in white blood cell counts and the body's immune system is low, so patients can develop infection. So we have to be very careful that if patients develop fever during chemotherapy, that needs to be dealt with emergency. These are some of the side effects, whereas there are some peculiar side effects for certain chemotherapy drugs, which will be discussed in detail when you are talking about your chemotherapy to your concerned doctor. During the time you are getting chemotherapy, you will need to get blood tests before each dose of your chemotherapy. That is just to make sure that everything in your body is perfect for you to undergo chemotherapy, and obviously we can avert some of the side effects by testing for the bloods before giving you chemotherapy. Commonly people ask what should be the precautions during chemotherapy. So they should eat healthy and have as active lifestyle as possible, keep on exercising as much as their body permits. After a few days of chemotherapy, they may feel fatigued, so rest may be needed during those days, but as they keep on recovering, they can go back to their normal routine and keep on doing exercise. As much as they remain active, the side effects of chemotherapy will be less. And regarding diet, they should eat whatever is cooked at their home and avoid street food. Raw food is generally avoided with very intense chemotherapy drugs, but can be taken when adequate care is taken of washing, peeling the fruits and vegetables. It can be taken. So that can be discussed with your physician who is administering chemotherapy to you. So about side effects, most of the side effects with chemotherapy are temporary, but there can be some side effects which can be which can set in late or can be long-term side effects. So majority of the times we don't have to worry about the side effects. As I said, most of them will be short-term. For example, about hair loss. After the chemotherapy is over, the normal hair growth begins after a couple of weeks to couple of months. It depends, varies from patient to patient, and obviously on the type of chemotherapy drugs that are used. Lastly, talking about what is the follow-up after the treatment is completed. Treatment can vary from couple of months in certain cases to maybe a couple of years in various cases, especially if we talk about breast cancer. Patients who are hormone receptor positive may need hormonal therapy or simple tablet type of treatment for 5 years. After that also, during that treatment, you need to be on regular follow-up with your concerned doctor, and after the treatment is completed also, you will need to be on almost lifelong follow-up. It will be like any other disease like diabetes or hypertension, where you keep on seeing your doctor at a specific interval of time depending on how well your disease is controlled. So the follow-up lasts lifelong, and just to make sure that everything is under control. So if there are any more questions, you should ask your doctor to answer those queries. Thank you.